Hello, everyone. Ivan here. When it comes to treating an acute injury, applying ice is the most common approach. Many believe that it can alleviate pain and promote faster healing. However, there is another school of thought that recommends active recovery to expedite the healing process. Which approach is actually better for recovery after an acute injury? Today, we will look to explore this question. First, we need to define what we exactly mean when referring to acute injuries. Acute injuries refer to sudden, traumatic injuries that occur as a result of a specific event, such as a collision, fall, or twisting motion, and typically cause immediate pain, swelling, or bruising. On the other hand, chronic injuries are typically caused by overuse or repetitive motions and can develop gradually over time, causing persistent pain or discomfort. The use of ice as a treatment for acute injuries became popularized with the introduction of the acronym R.I.C.E, which stands for Rest, Ice, Compression, and Elevation. Dr. Gabe McCurkin is credited with coining this term. However, in 2015, Dr. McCurkin retracted his initial hypothesis, stating that ice may actually delay healing instead of promoting it. This information has led to some debate among medical professionals regarding the effectiveness of ice in injury treatment. Some argue that ice may be useful in reducing pain and swelling, while others suggest alternative methods such as active recovery. To lay the foundations for discussing the effects of ice on injury recovery, it's important to understand the general mechanisms of soft tissue repair. This process can be divided into three distinct stages: the inflammatory stage, the proliferative stage, and the remodeling stage. By familiarizing ourselves with these categories, we can better appreciate how ice may impact the body's natural healing process. Inflammation is a natural process that occurs in our bodies in response to injury. It's a complex biological process that involves various cells and molecules in our immune system. Despite contrary beliefs, inflammation is an essential part of soft tissue healing. During the acute inflammatory phase, the body's response is focused on removing damaged cells and debris while preparing the wound for repair. Chemical signals such as histamine and prostaglandins play a key role in causing blood vessels to widen, allowing immune cells like neutrophils and macrophages to enter the injured area. Clinically, inflammation is observed as swelling, redness, increased temperature, pain, and loss of function. Swelling isn't necessarily bad. Swelling is merely the buildup of waste around an injured area that needs to be evacuated via the lymphatic system, which we will discuss in a later slide. In the soft tissue healing process, the proliferative stage is the second phase, following the inflammatory phase. During this phase, new tissue is generated to replace the damaged or lost tissue. Fibroblasts play a significant role and are the key cells responsible for producing collagen and other extracellular matrix components. These cells migrate to the injured area and begin to produce collagen, which provides a scaffold for the growth of new cells. Blood vessels also continue to grow into the area to supply the developing tissue with oxygen and nutrients. As the stage progresses, the number of inflammatory cells such as neutrophils and macrophages gradually decreases. The new tissue gradually gains strength and flexibility, leading to tissue repair. The remodeling stage is the final phase of soft tissue repair and follows the proliferative stage. This phase is focused on restoring the tissue's function and strength to its pre-injury state. During this phase, the newly formed tissue undergoes a process called remodeling, where collagen fibers realign and mature, making the tissue stronger and more resilient to stress. Collagen fibers continue to reorganize, leading to the tissue's increased flexibility and strength. The length of the remodeling phase can vary dependent on the extent of the injury and the individual's overall health, and it can last for several months to years. Now that we have a better understanding of the 3 stages of soft tissue healing, let's explore how the application of ice may impact the body's natural healing process. This study investigated the impact of icing on muscle regeneration following a crush injury to the rat's extensor digitorum longus muscle. The rats were randomly divided into 2 groups. One group received no icing treatment, while the other group received ice packs applied for 20 minutes. 3 days after the injury, the group that did not use ice treatment had thin muscle cells with a large central nucleus, while this was not observed in the group that used ice treatment. At 4 days after the injury, the group that did not use ice treatment had larger regenerating muscle cells compared to the group that used ice treatment. The study also found that the cross-sectional area of regenerating muscle fibers was significantly larger in the non-icing group compared to the icing group at both time points. At 28 days after the injury, this difference was statistically significant. These results suggest that icing may have a negative impact on the growth and maturation of regenerating muscle fibers. The size of the regenerating muscle fibers in the icing group was significantly smaller than that in the non-icing group at 28 days after the injury, indicating that icing could have a delayed differentiation in the early stage of regeneration and considerably hindered the maturation of regenerating muscle fibers in the later stages. This graph depicts the number of macrophages over time in both groups. It revealed that the peak number of macrophages in the icing group was delayed by a day compared to the non-icing group, indicating a delay in the inflammatory reaction. This delay led to an impairment in muscle regeneration, implying that the timing of the inflammatory response is critical for proper muscle regeneration. Now that we've delved into the adverse effects of using ice on soft tissue healing, let's turn our attention to the impact of movement on the healing process and its capacity to expedite recovery. As previously stated, swelling arises from the buildup of waste around an injured area that must be evacuated via the lymphatic system. Although this is a natural reaction to injury, it can become problematic if the waste-filled fluid is not properly drained. To understand how the lymphatic system enhances the healing process, it's imperative to differentiate between the circulatory and lymphatic systems. The circulatory system is an active process that is always on, responsible for delivering oxygen and nutrients to every cell in the body. The circulatory system's active role is essential in maintaining homeostasis by regulating blood pressure, temperature, and pH levels in the body. The lymphatic system is a completely passive process, which means you have to make it work. When we move, our muscles contract and relax, which stimulates the lymphatic vessels to contract as well. This contraction of the lymphatic vessels helps move lymph fluid, waste, and immune cells away from the injured area and towards the lymph nodes. Once in the lymph nodes, these fluid and cells can be filtered and processed before being returned to the bloodstream. By promoting lymphatic drainage through movement, we can help reduce swelling, inflammation, and pain while also promoting tissue repair and regeneration. Gary R.I.C.E has a perfect analogy to explain the importance of movement for lymphatic drainage. Imagine if you knew it was going to snow 2 inches every hour for the next 12 hours. What would you do? Most likely, you would open your front door and sweep off a small amount of snow every hour to avoid a buildup. If you waited until the snow stopped falling, you would have to deal with 24 inches of accumulated snow all at once, which is much more difficult. Similarly, when you stop moving, lymphatic fluid accumulates around the injured area, leading to swelling. So based on what we just discussed about the effects of icing and the benefits of active recovery, the question arises, how can we take this information and apply it in a practical setting? What are some recommendations we can give to individuals who have just sustained an acute soft tissue injury and are looking to optimize their recovery? In the next slide, we'll discuss some practical recommendations that are backed by the current literature and can be easily implemented by anyone looking to speed up their recovery process. If you have ever experienced an injury, you've likely been advised to use ice to reduce inflammation. Again, it's important to understand that swelling is simply the accumulation of waste around the injured area, which needs to be evacuated through the lymphatic system. Although swelling is a natural response to injury, it can become problematic if the waste-filled fluid is allowed to accumulate. Despite this, the current literature doesn't support the idea that icing an injury is an effective method for promoting soft tissue healing. However, this doesn't mean that ice is entirely useless. Ice can be utilized as a powerful pain management tool. If you're struggling with excruciating pain, Dr. Gay McKirkin suggests applying ice for up to 10 minutes, removing it for 20 minutes, and repeating this process 1 to 2 times. However, active recovery can be a valuable tool in speeding up muscle repair as it can activate the lymphatic system, which helps to move lymph fluid and waste that accumulates during the inflammatory stage. However, it's important to be cautious about how much we're moving during this time. Moving too much can cause further damage to the soft tissue, which can slow down the healing process. To avoid this, it's advised to move within a pain-free range, gradually increasing movement and intensity as the injury heals. Thank you for watching this video. I hope you found it informative and helpful. For more content related to rehab and fitness performance, don't forget to subscribe.